All right, class, here we go. This time we're going to do the cardiovascular system. So the heart, the blood. Pretty cool, huh? Like this little GIF here. All right, let's see if we can get started here. Okay, let me put myself in the corner. Okay, so the cardiovascular system. So if you had to have a definition of it, a closed circuit that consists of the heart and all the blood vessels. So we'll talk about what arteries are, what capillaries are, and what veins are in just a second. But a functional cardiovascular system is vital for supplying oxygen and nutrients to tissues and of course removing waste. And the number one waste product will be carbon dioxide. Okay, so arteries transport blood away from the heart, but arteries transport oxygen-rich or red blood away from the heart. Veins will transport, we call it blue blood or deoxygenated blood toward the heart. And the capillaries are vessels that run between arteries and veins. Okay, so they are joining the arteries and veins, and then it can take the waste products and the carbon dioxide, unload it, and then send it back to the heart. So the whole purpose of the heart is to receive blue blood, deoxygenated blood, send it to the lungs. The lungs will do its thing and oxygenate it, and then it'll send it back to the left side of the heart, and the heart will send it to the rest of the body. So it's pretty cool. Now, oxygen-poor blood is carried by the pulmonary circuit to the lungs, where it picks up oxygen and drops off the carbon dioxide, like I was mentioning. And the systemic circuit sends oxygen-rich blood to all body cells, where it drops off oxygen and picks up carbon dioxide. So there it is in a nutshell. So if you look at this diagram, so here it is. So if you look at this, now the superior vena cava, which is going to dump into here, is going to drain the blue blood from your head and upper extremities. The inferior vena cava is going to drain the blue blood from your abdomen and your lower extremities. And so it will dump into the first chamber, which is the right atrium. And then it will go through a valve called the tricuspid valve or the right AV valve. And this right ventricle will pump, and it will go through the pulmonary valve, through a pulmonary trunk, and pulmonary arteries. So keep this in mind. Yes, I said arteries, into the lungs. Now, Patel, you just got done saying arteries are red and veins are blue, and then the first thing you teach me is that this pulmonary artery is blue. I know. I apologize. There's always an exception to the rule. This is the one exception. The reason is it's still going away from the heart. So arteries away from the heart, and it's going to the lungs. So it's carrying blue blood away from the heart. The lungs will do its thing, and guess what? It comes back via pulmonary veins, which are red in the heart. I know, that's the only exception. Everywhere else in the body, arteries are red and veins are blue. Then the left atrium will take that oxygen-rich blood, go through the mitral valve, bicuspid valve, or the left AV valve, and then through the left ventricle, and the left ventricle will pump through the aortic valve, aortic arch, and then through the rest of the body. Now, when the heart does pump, it does have a blood supply of its own, so that will pump off, it'll branch off first, and then there are a couple of other branches that come off the aortic arch, which I'll teach you a little bit later. But just to kind of give you an idea, the whole purpose of the heart is to take blue blood, convert it, or take it to the lungs, convert it from blue to red, and then the left ventricle will pump the red blood to the rest of the body. That's it in a nutshell. Okay, and then of course there's fancy words along the way, which we'll repeat over and over again. All right, so the cardiovascular system provides oxygen and nutrients to tissues and removes waste. The cardiovascular system transports blood, vital in transporting substances between large cells and the external environment, therefore maintains a stable internal environment. And we'll talk about blood and all the contents of blood in just a second, but the average person has about 5 liters of blood. Men have a little bit more just because of their sheer size. Men are a little bit larger than women, so men may have a little bit more blood just because they are on average larger. What do you find in blood? Red blood cells. So they carry oxygen, carbon dioxide, and hydrogen transport. You have white blood cells that protect against disease and infection. You have platelets, which are little cell fragments. Cells are incomplete, but those are the things, if I cut myself, then the platelets will come in and help clot the blood. Okay, those that are in blood thinners, they take longer to clot, therefore a little nick can be very dangerous for them. And then plasma is the clear liquid, and that's a mixture of water, amino acids, proteins, carbs, lipids, vitamins, hormones, electrolytes, and cellular waste. Okay. Now, what's the purpose of having a cardiovascular system? Well, it's got to move oxygen and carbon dioxide, move nutrients, pick up wastes, move hormones, and then there's some stem cells that are found in there as well. Obviously, you have a cardiovascular system for protection. It prevents blood loss, inflammation, white blood cells, and antibodies fight toxins and infections, and regulation, balancing of fluid levels, pH, and temperature. Now, your blood is slightly warmer than your body. Your body's 98.6 roughly degrees Fahrenheit, and blood will be about 100.6. So it is a little bit warmer. Okay. If you look at these are all the white blood cells. Now, each white blood cell has a purpose. So when you go to the doctor's office and they take your blood, and we call that a CBC, which is a complete blood count. Let's say it comes back that you have a whole bunch of neutrophils. And so we have this norm, right? And then it says you have elevated amount of neutrophils. Well, what we do is we say, okay, well, what do neutrophils do? So we find that neutrophils are there to fight bacteria. So if all of a sudden in my blood I have a whole bunch of neutrophils, well, then the body made more neutrophils, right, to fight off that infection. Therefore, I have a bacterial infection. Right, so that you can use blood work to kind of determine what's going on. So let me give you another example. Eosinophils, these are found as an allergic reaction. So when a person has allergic reaction or allergies, the eosinophil count goes higher. The other scenario is that if there's parasites. So you're like, okay, allergies or parasites? Well, what is it, Patel? Well, it really depends on the situation. But if a patient comes in, we do their blood work, and their eosinophil count is high, well, you got to ask them, hey, did you just visit a foreign country? Did you eat some street food? Then I gear towards more of the parasite. But if they say, no, I was in the garden and I was playing with the grass and flowers, I'm like, okay, well, then maybe your eosinophil count is high because of that. So that's what it gives you. It gives you an idea, but always ask the patient, where have you been? What have you been doing in the past few days that might have changed it, or past week, or whatever the case may be, because your blood work might not change day to day, but over time. So always ask them, hey, did you visit Thailand for a year or Thailand for a few months and just ate nonstop off of the street food? Well, you're going to get parasites for sure, right? So just kind of keep that in mind. Now, components and general properties of blood, we have plasma, which is the clear. 55% of your blood is plasma. And then you have formed elements, which are your red blood cells, white blood cells. You have platelets that help with blood clotting, and then you have cells and cell fragments. So if you look at this, the makeup of blood, 55% is plasma, 45% is red blood cells, and less than 1% are my platelets and white blood cells. Okay. I don't know if you've heard of PRP. That's platelet-rich plasma. Okay, so blood, as you know, is liquid that contains red and white blood cells and platelets. Platelets help clot the blood and contain hundreds of proteins called growth factors for healing of injuries. So let's say I had a patient that had chronic tennis elbow or patellar tendonitis, and nothing's really worked. Well, we can say, well, maybe you want to try PRP. So what they do is they take your own blood, they'll centrifuge it, and they'll separate the plasma and the platelets. And what they'll do is blood is drawn from the patient in test room and then placed into the centrifuge for a spin. And this part is what they'll inject back into the elbow or inject back into the knee. And the whole theory behind it is, well, if the PRP has 5 to 10 times more platelets than what is typically found, the concentration of platelets and growth factors may be important in healing and can potentially regenerate tissue and cartilage. So you can give it a shot, right? Give it a shot. They are expensive, from $500 to $1,000. They became popular with Kobe Bryant and I think Alex Rodriguez. They used to fly to Germany to get these shots because they weren't approved in the US. But they're approved now, and you can try it. So the heart in general is a hollow, cone-shaped muscular pump within the mediastinum in the thoracic cavity. The size and location of the heart, the average heart is about 14 centimeters long and 9 centimeters wide. It's about the size of your fist. It's found right in the middle of your chest and slightly deviated to the left. You know, a lot of times we pledge allegiance and we kind of put our hand over the left side, but really our heart is right in the middle here. So the heart lies between the lungs, between ribs 2 and 5, and that's where you would listen to heart sounds. Anterior to the vertebral column and behind the sternum. So right here. The base lies beneath the second rib and the apex extends to the 5th intercostal space. So here it is right here. Okay, so when you're going to listen for heart sounds, you're going to listen in the intercostal spaces of the second rib on the right side, the left side, and then the 4th intercostal rib and the 5th intercostal rib. And when we talk about valves, I'll tell you which ones you're going to listen for right in here. Okay. Now the heart itself has a few layers that we want to talk about. The first layer is called the fibrous pericardium. And this fibrous pericardium pretty much anchors the heart in your space right here called the mediastinum. So it anchors it down. And then you have something called the parietal pericardium and then the visceral pericardium. That is found, and then in between we have this pericardial cavity which has a fluid in there and helps lubricate the area so that when you're taking a deep breath and the heart is pumping, boom, 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 it's a smooth little bump and it's not. Now, sometimes this fluid can dry out due to bacterial viral infection and we get pericarditis, we can get pleurisy in the lungs, and what happens is you ever rub sandpaper together, it's basically just friction. So how do you treat it? Well, usually you treat it with anti-inflammatories, corticosteroids, pain medications, and if it was bacterial, antibiotics. If it's viral, we wait and hopefully the immune system can do its thing. So here's the aorta, here's the pulmonary trunk. Now your body also has auricles. Now these auricles are structures that are attached to our atriums. And what these do is they allow the atrium to expand in case that you've got an excess amount of blood that comes in. So auricles are different than atrium. The atrium is your chamber, and the auricle is an extra structure that can allow for more blood to come in at the area. Okay, so keep that in mind. Now, the pericardium is a membranous sac that encloses the heart. You have pericardium consists of 2 portions. The tough outer connective tissue is called the fibrous pericardium, and the more delicate inner layer is called the serous pericardium. And that serous one is the one that is that double layer that has the fluid in between, and the outer layer is called the parietal pericardium. Okay, and then you have the visceral pericardium, the inner layer of the serous membrane, and that covers the heart. So you have a lot of layers. So let me break it down. You go fibrous pericardium, which is the tough outer portion. Then you go parietal pericardium. Then you have this fluid. Then you go visceral pericardium. Okay? And the visceral pericardium is also known as the epicardium. Now, these are all the layers that I just talked about. So imagine taking a water balloon and then making a fist go through. You know how the water balloon would just kind of surround your fist? So there it is. There's that example. So it's nice and protected there. Okay. Now, you have 3 layers for the walls of the heart. Remember these prefixes epi, myo, and endo? You're like, oh yeah, I remember that from muscles. Yeah. So the epicardium is the outermost layer, a serous membrane made up of connective tissue and epithelium. Basically, the purpose, as I mentioned to you, it decreases the friction in the heart. The myocardium is the middle layer. That consists of the muscle, and it's the thickest layer. That basically helps pump blood out of the chambers. So the myocardium is our pumping layer. The endocardium is the innermost layer made up of connective tissue and epithelium, continuous with the endothelium of major blood vessels joining the heart, and it contains the Purkinje fibers, part of the cardiac conduction system, which will help transfer electrical current so that you can beat boom, 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 boom. Okay. So again, here's a nice little diagram of the layers. You have the thick outer fibrous pericardium, then you have a parietal pericardium, then you have fluid in between inside the pericardial cavity. Then you have the visceral pericardium, which is there, which is the outer layer of the heart. Then look how thick this myocardium is. Looks like salmon, tuna. And then you have the inside, which is the endocardium. Okay. All right, we'll talk about the chambers in the heart in the next section so that you can get a little break here.